What are the best exercises for preventing knee injury? Now, this is video one of a list of 100 common questions that I get asked. By no means is it the most important, it is just where we are starting. Now, in this video, I'm going to give you 5 things to think about in order to prevent knee injuries. They are 5 principles that I've used very successfully here in my clinic to rehab knee injuries, to treat knee injuries, and often they're the things that I've seen people have missed when they have had long unsuccessful knee rehab, and they're certainly the principles that are going to help you to prevent knee injury. Now, point 1, we need to consider that the knee is a slave to what happens at the ankle and at the hip. So the knee is not super keen on rotational or side-to-side movement. It really wants to bend in one plane, and our ligaments are there really to stop it moving too far out of this bending, hinging sort of movement. However, the ankle has lots of stuff it can do rotationally. The talus kind of sits underneath the tibia and the fibula. It sits on top almost like headphones, and there's a lot of rotational movement at this joint, and we can see a lot of different kind of loading in different planes here. We need to consider that if there's kind of skewed orientation here, it's going to put a lot of torque at the knee. If we were to consider maybe the ankle really wants to orientate one way, and then we look at the hip and it's orientating another, there's going to be a lot of torque at the knee there, and that's going to put us into loading patterns where the knee's going to get pretty grumpy around that. So we want to consider that there's stuff going on at the ankle and the hip that could pull the knee out of the optimal position it wants to sit in. Certainly a lot of people are doing work on their hips when they come in to see me around their knee injuries and rehab, but often they don't consider the relationship between both the hip and the ankle. So point 2 is looking at, we want optimal pronation and supination mechanics at the ankle. So what that means is we want our talus here to be able to rotate internally, pronation, and all the way up to supination. Oftentimes I will see someone who they might be in an everted position, what some people would say a pronated position, which means that the tibia is going to be slightly rotated in that direction. That's going to put a lot of torque at the knee itself. And if we consider that, well, maybe the hip can come along for the ride too, we can see rotation there. In terms of that hinging movement, it's still going to be somewhat off, and we might see more prone to knee injury there, particularly when we're looking to load force into that. It's not going to handle things like jumping or running very well, because pronation is also part of dissipating force as well, and we'll talk about that in a little bit. But we want to make sure that the foot can move through both of these things. Now, often people talk about pronation as a nasty, bad thing. They vilify it somewhat. It's a very important part of loading patterns up the chain. We want to be able to pronate fully, we want to be able to supinate fully. If we don't do both of those fully, the ankle is going to want to sit somewhat skewed either one way or the other. Especially when we look at a foot that tends to sit in supination, and this sometimes can be the case for someone who's been in an orthotic for a long time that might not necessarily have needed it. We see a lot of kind of lateral loading patterns at the foot, and we're going to see a foot that doesn't want to pronate. That's an entire system that's just not going to absorb force very well. So pronation's not bad. Being stuck in supination is just as bad too. Neither are bad or good. It's all about, can we move all the way one way and all the way the other way. If we don't move all the way, we don't have a joint that sits well in neutral. So point 3 would be being able to move well at the hip and to be able to load positions well at the hip. Now, if we think about pronation again, as we're coming into pronate, the tibia wants to rotate in, femur wants to rotate in, the glutes come along to pull that back and decelerate it. So part of the function of the glute when we're loading in these positions is to decelerate force and to dissipate that force to slow these movements down. So oftentimes I see people, they've been given exercises for their hip, they're doing their clamshells and all these things that they think they're on the right track. Unfortunately, we need to be able to load these muscles in positions where they're going to be worked. So for example, we want to put our body in a position where the glute is being forced to decelerate pronation, because that's where it's going to work. This also is the same for sport-specific positions. We want to return to sport when we know that we can decelerate the positions that we're going to be in. So that would also be things like, can the glutes handle landing, jumping, and not see us kind of really skewed at the knee as a result of not quite catching that force at the glutes and the hip. So it's about having strength in those muscles to control the positions and to stop, not just have to rely on the ligaments at the knee to control these rotational and side-to-side movements. It's about having those muscles at the hip in that position being able to fire. So that also goes the same for, we want a hip joint that moves well. If the hip is just skewed in one direction, let's say it's a pelvis that is orientated in one specific position, that's a femur that won't rotate well internally and externally. So that's also going to cause a joint to sit not in that optimal neutral position. It's going to be skewed slightly one way. It's almost like the neutral position shifts in terms of where the joint wants to go. So we want that neutral to be in the middle and a full healthy range of motion, both internally and externally, as well as all the other planes of motion as well. When we look at the knee itself, so this is point 4, we want to make sure that we have good local strength and loading patterns around the knee. So this is good patella tendon loading. This is making sure all the muscles around the quads and everything can actually handle those loads that you're throwing at it. So this is particularly important in a sport-specific scenario where we want to make sure that the muscles are able to also dissipate force at the knee in landing mechanics and things like that. Oftentimes people come in and they've been doing a lot of work on their VMO, and with this idea that this orientation of that muscle is responsible for controlling the patella there. I think that's a really simplified way of looking at it, and I don't think it's necessarily the way we want to head when we're looking at preventing knee injuries and rehab. There's much more going on that we should be addressing first before we're just looking at this muscle. Unless, of course, we test it and we go, hey, nothing's happening here. Let's make sure we get our strength going here, and then we'll look at our mechanics. And this is also the same for at the hip. Whilst I kind of, have a bit of a go at things like clamshells and stuff like that, they can play their role in terms of improving neural output, but you've got to move on past that. You need to bring things into positions where they're going to get loaded. And point 5 is ensuring that we have optimal gait mechanics. So obviously that's good supination and pronation, but we need to realize that these are full body movements. So they're not just a foot movement, it's what happens as a result of all these things. We can get really good at exercise and our clamshells and all these other things, but we need to put them into what we're normally doing. I often have people come in and they say, I hurt my knee because I was doing agility exercises, or I upped my running load, or I was running stairs, or they had this thing, they had this reason for it. But if that was the reason, everyone who did that thing in that sequence they did it would always have a knee injury. So that's not the case. Usually those people who have those knee injuries have been predisposed to it through these things I'm talking about, slight torsion, not good dissipation of force, poor mechanics around the ankle, hip and knee. These things make you prone to repetitive loading patterns that are slightly off and over time cause pain and injury. So we want to make sure the thing we're doing the most is walking around, or at least I think nearly everyone, that's the thing they're doing the most. They're walking more than they're exercising. So we want to make sure that those mechanics we have in our gait are optimal. That means that hips that can hike equally side to side, they can rotate the same side to side, they can shift side to side, and all of these deceleration forces and loading mechanics, that all of these joints really throughout the whole body are doing what they should be doing. Sometimes we can even see things like someone might have a shoulder injury, so that stops them swinging their arm on one side, and so the torso wants to only rotate in one direction. This can be responsible for now causing torque on the knee as well, and putting you in a position where if we start loading it with force, it's not going to be happy. So just to quickly go over those 5 points again, we want to consider the knee is a slave to the ankle and the hip. We want to ensure good pronation and supination mechanics at the foot ankle. We also want to ensure good movement and strength and loading capacity at the hip. We want to make sure we have good loading capacity at the knee. and we also want to make sure that we're checking in on our optimal gait patterns, and that's certainly something I could go a lot into, but that should be another whole series of videos around the gait stuff. So I'd really like to show you some exercises around these things as well, just to talk about moving the foot and loading, some of the best ways to load the hip. What I'll do is I'll upload some more videos to this channel, I'll put them on my socials, but even better, if you want to opt in to this weekly email out, I'll put a whole bunch of info and dive a bit deeper into that there. So there'll be a link here somewhere that you can check out, and if you have any questions, please ask, and I will see you in the next one.